Good afternoon. Welcome to everyone today. I wanted to provide the community with an update on the current situation related to COVID-19 and our community's response to this public health emergency. On March 5th, Governor Hogan declared a state of emergency in Maryland. On March 11th, the World Health Organization declared the global emergency a pandemic. On March 13th, the federal government declared a national emergency and enacted the first of many subsequent actions geared toward combating the virus. Washington County government declared a local state of emergency on March 16th, and the city of Hagerstown declared a civil emergency also on March 16th. This is the first pandemic known to cause a new coronavirus. To date, most research and guidance related to the preparedness for and response to pandemics has been specific to influenza, although some of the same principles can be applied in this case with our current COVID-19 pandemic. This is an unprecedented public health emergency, and we're all in this for the foreseeable future. Probably not weeks, we're probably talking about months. To be clear, we have reached a critical point in our fight against this deadly illness. Over the course of the next 2 to 3 weeks, we could experience a significant rise in cases. Washington County saw its first confirmed case on March 21st. In the 10 days since this first case, our number of confirmed cases has risen to 15. The age distribution among our cases are 2 cases in the 10 to 19 age group, 1 case in the 20 to 29 age group, 1 case in the 30 to 39 age group, 4 cases in the 40 to 49 age group, 1 case in the 50 to 59 age group, 6 cases in the 60 to 69 age group, and no cases in the 70 to 79 or 80 and above. The distribution by gender is 33% male and 67% female. Currently, of all of the 15 confirmed cases that we've had, 2 individuals have been released from isolation. Sadly, currently we have 1 individual that is hospitalized. I understand the public's concern and the desire to know more information about confirmed cases in our county. However, state and federal patient privacy laws prohibit this information from being released. But be assured that contact investigations are being conducted, and through these investigations, individuals who are determined to be at high risk are notified and provided with guidance and recommendation. During this process, a public health nurse conducts an interview with the patient to determine close contacts and anyone who may be at risk for infection. We must move forward on the premise that the virus is in our community and take the necessary steps to protect ourselves and our community. As I've stated before, and I'll state again, there are steps we all must take to prevent the spread of respiratory viruses, including COVID-19. Wash your hands frequently. Avoid touching your eyes, mouth, nose, and face. Disinfect surfaces, including cell phones. Avoid contact with people who are sick. If you are sick, stay home and away from others. And most importantly, social distance. Adhere to Governor Hogan's executive orders. Governor Hogan has instituted restrictions for a reason. The need to social distance is critical. We must stop the spread of the virus and flatten the curve. A flatter curve results in fewer people infected at this critical juncture, which prevents a surge that would inundate the healthcare system, which would potentially result in fewer deaths. What you do matters. What you do today matters, what you do tomorrow matters, and what you do moving forward matters. Although most individuals who become infected only experience mild symptoms and can handle the illness, adhering to these recommendations is critical to avoid the spread to more vulnerable members of our community. If you have symptoms, stay home. Contact your primary care physician. If you're experiencing severe symptoms, call 911. People who are mildly ill with COVID-19 are able to recover at home. Do not leave your home except to get medical care, get to your doctor's appointment, and always call prior to visiting any medical facility. Washington County's response to this public health emergency is being coordinated through the Emergency Operations Center. This group of dedicated professionals is committed to the health and safety of every resident in our county. The Emergency Operations Center is operating at full activation and is in close coordination with the Maryland Department of Health, the Maryland Emergency Management Association, Meritus Medical Center, and other state and federal partners. Critical areas of focus for the Operations Center have been establishing an incident command structure designed to enable effective and efficient response management, establishing plans to address COVID-19 related needs, namely hospital surge and testing needs, coordinating and managing resource requests, establishing a joint information center to provide timely, clear, consistent messaging to the public, stakeholders, and the media. In short order, a few of the key plans the EOC and our partners have established are hospital surge, communications, and first responder healthcare safety. The EOC has also coordinated the acquisition of medical resources from the Federal Strategic National Stockpile, Hagerstown Community College, and other sources. Hagerstown Community College has contributed thousands of masks and other supplies, and the Strategic National Stockpile has also supplied thousands of masks and other supplies such as gowns and gloves. Addressing this emergency will take a sustained effort by everyone. To be clear, there is no vaccine, there are no antiviral treatments. We will get through this together, but everyone, and I say everyone, must take this threat seriously and heed the recommendations of public health experts and adhere to the restrictions put in place by Governor Hogan. At this time, I would like to thank our dedicated public health experts, public relations staff, healthcare and emergency planners for their tireless work. I would also like to thank the many healthcare providers and first responders for putting their health at risk and keeping everyone safe. If anyone would like to provide donations, such as masks and other medical supplies, please email the EOC at oem.covid19@washco-maryland.net. Up next from Meritus Health is Dr. Doug Spotts, the Vice President and Chief Health Officer.
Thank you, Earl, and it is really my privilege to speak to you today to thank the County Health Department, the county, and our broader community for their partnership at this time of crisis. First, I speak to you, though, as a family doctor, my background, and I can't underscore enough the importance for everyone to socially isolate, stay home, and practice hand hygiene. Those are absolutely the major things that we all can do to help one another. You're not just doing that for your own safety, but you're doing that for the safety of the entire community. Check in with your neighbors. Use this as a time to be focused on what really matters. And that is, I often get asked that question, what can I do to help in any situation? And again, stay home. Now, speaking on a number of initiatives of what Meritus has done to partner with the County Health Department and our community, I'd like to highlight just a few things. First of all, we have a COVID-19 care line, 301-790-9170, and that is for any COVID-related question. We have, in short order, stood up telehealth visits, and we encourage you, if you're having any symptoms, to talk to your healthcare provider first and foremost. If you don't have a healthcare provider, you can find those resources at meritushealth.com or at the COVID-19 line I just talked about, which can connect you to a telehealth service with one of our providers. In addition, the Meritus Medical Group practices have also begun doing telehealth visits, and also, we have extended to the community physicians an ability to have a WebEx tool to do their own telehealth visit within their own electronic health record. Those are three really key initiatives to, doesn't take the place of an in-face visit, but it's very, very crucial to be able to lay eyes on you as a patient or your loved one, and it can be done with simple technology. We can also do that by phone as well if you don't have the technology to do the televisit, but there are simple instructions and a pretty easy way to get connected if you already are not connected to a provider. In addition, we have one drive-through and now one walk-through screening clinic. And I want to really emphasize that due to limited testing supplies and guidelines for testing from the CDC and the Maryland Department of Health, the criteria at these screening centers are very specific. You also can see those criteria at meritushealth.com as well. At this time, those younger than 18 will not be tested at the screening centers. If you feel your child needs evaluated for possible COVID-19 symptoms or is at high risk for some other health condition, please talk with your physician or visit the urgent care center at Meritus. People without symptoms do not qualify for testing at this time. People at low risk do not qualify for testing at this time. Occupations that are considered high priority by the state at this time include Meritus healthcare workers and Washington County first responders of all types. Just changed was the requirement that age 60 or older do qualify. And then, of course, underlying conditions or high-risk comorbidities. I also want to address the turnaround time with labs because there are a number of rumors circulating about these times. We are working at Meritus with a commercial lab, and that lab test and the turnaround times are really an issue all over the country. We continue to track and monitor it. As soon as those test results are available to us, we are calling all those who have been tested at our screening centers. The commercial labs are extremely busy, as you all can understand, during the current pandemic, and so we ask for forbearance and understanding when those test results are taking longer than expected. We have had a rumor that some test results are lost, and that has not been confirmed, and we continue to work with the commercial lab to find those test results, and we'll get them to you as soon as possible, and that I can't underscore enough as well. Again, I would emphasize the vital importance of social distancing, staying at home, and hand washing. Even with COVID-19 test results, as we just heard from Earl, the treatment doesn't change. We don't have treatments for this. So if you find yourself with worsening symptoms, severe 911 type symptoms, that's when it's appropriate to have a 911 call. But if you're not sure in between, I've given you those other resources that you can turn to for guidance and help and thinking through and processing it so that you're not doing that just alone on your own. All of these strategies are geared toward keeping only 911 appropriate people giving them access to the ER and keeping everyone else out of the ER and these other venues of care so that we can be prepared for the surge when it comes. Thank you very much.
Next will be Scott Nicewarner from the City of Hagerstown.
Thank you, Earl. Just some quick comments for the public to reiterate to our City of Hagerstown residents and customers that the city remains open for essential services, including but not all inclusive of water production and wastewater treatment, electric services, trash pickup and recycling, and of course, fire and police services. We also remain open through our online portal for processes such as permitting and utility customer service inquiries and payments. One thing I want to reiterate to the public is that city parks, though not physically able to be closed in 90% of our cases, should be utilized only within the recommended guidance of our health officials. Please abide by the signs we have posted at our parks and do not utilize our pavilions and playground equipment during this period. The greens at Hamilton Run Golf Course is also closed and should not be used by the public over the course of the governor's latest order. We continue to utilize our communications channel, Channel 25, Facebook, Instagram, and YouTube to provide information to our residents and customers, and will continue to do this through this event. Please go to our website at www.hagerstownmd.org for any additional information related to future events, as well as general city information. I want to thank our city staff especially, who continue to serve our citizens during this pandemic. Your dedication and commitment during this difficult time is sincerely appreciated by all of us who are the beneficiaries of your service. We also want to thank the members of the EOC for their diligence and commitment during this event, and the city remains committed to the EOC for whatever services that the city may provide. Thank you.
At this time, we'll have Kirk Downey, Interim County Administrator.
Good afternoon. I'm here to speak to you about updates to Washington County government related to COVID-19 and our ongoing efforts to flatten the curve and slow the spread of the virus so our healthcare and emergency services providers have more time to prepare. First and foremost, I want to reiterate what the governor stated in his press conference yesterday. There is now a stay-at-home order. This means that unless it is absolutely essential for you to leave your home, please stay put. Essential reasons include working an essential job, obtaining food or medicine, seeking medical attention, or for other necessary purposes. In addition, only essential businesses are allowed to remain open in Maryland, and those businesses must make efforts to scale down their operations in order to reduce the number of required staff, to limit interactions with customers, and to institute telework for as much of the workforce as is practical. Under this directive and in this environment, county operations will now be operating with an extremely limited staff. The Division of Plan Review and Permitting will be offering essential permit reviews only. The Department of Water Quality will continue to provide water and sewer services, with a reminder to all citizens to only flush toilet paper down the toilet. Flushable wipes and any additional items can lead to sewage backup and a possible disruption in service. The landfill will continue operations, but residents are strongly urged to refrain from bringing bulk items and yard waste to the landfill. You are putting both yourself and our staff at great risk for contracting COVID-19. While we recognize many people may be cleaning out their homes and garages, please do not bring these items to the landfill until the state of emergency is lifted. Transit operations continue, but at a reduced schedule. Finally, county staff continue to evaluate ways in which meetings and hearings may be conducted virtually. I want to thank citizens for understanding that there are changes to the way county government normally operates. And to county staff, I say thank you for your dedication, your commitment, and flexibility during these challenging times. Local government has a responsibility to continue operations of critical infrastructure and to provide credible and timely information to our community members. We encourage all citizens to visit the county's COVID-19 webpage. It is updated daily and may be found at www.washco-md.net/coronavirus-info. I encourage you to stay informed, stay home, and stay healthy. On behalf of Washington County government and the Board of County Commissioners, I would like to extend a special thank you to the healthcare professionals, first responders, educators, manufacturers, and all other workers that continue to provide essential services to our community. To those of you staying at home, thank you. You are doing your part to address this public health emergency. Together, we will persevere through these unsettling times. Please be safe and do your best to stay healthy for yourself, your family, and your fellow citizens. With that, I'll say thank you and open the floor to any questions.
sheer speculation, I understand, but a couple of you have mentioned be prepared for the surge. Um, the obvious dumb question is, when might it come and how bad might it be? Do we have any algorithms or anything from the data so far that indicates how bad it might be? And when it might come?
There are about 1 million algorithms and models and projections out there. Um, putting it all together for Maryland, probably in the next 2 to 3 weeks, mid-April, we are planning sort of for the peak here. Don't know any real numbers at this point, but to say that we've really been making a push to have our plans ready, and you never know what's going to happen. So mid-April.
I read a notification on an email I received from Washington County government that said you guys were looking into a possible case of coronavirus at a local Walgreens. And there were several reports to our radio station that some customers that were in the store that day were concerned about their well-being. Can you address that?
It's my understanding that we contacted, I didn't personally, but we contacted Walgreens and were notified that the store was closed due to low staffing. And I believe we got that out through our JIC. Okay. Oh,
What about the stay-at-home order as it pertains to local businesses? I know a lot of people are concerned about the economy and its effect after this pandemic is over. What can you say about resources for small business loans and maybe some words of comfort to people that think they're losing their livelihood in this pandemic?
I can speak to that generally. As you may have known, the governor has made available, with the support of the General Assembly, some resources. There's a layoff aversion fund that has been put together. There's been assistance and additional programs set up by the Small Business Administration to provide low interest loans during this time, to provide bridge funding or gap funding. Obviously, we recognize that this is a very difficult time for small businesses. It's a time of great uncertainty. Watching the national news, obviously there is surges in the unemployment level, and businesses are trying to respond to the environment in which they find themselves as best they can. Again, I would encourage local businesses to look at the county's coronavirus page. There are information there regarding the state and federal programs that have been rolled out. We are continuing to push that information to the public as we receive it. I would also point out that I believe Greater Hagerstown Committee, as well as the Chamber of Commerce, has been doing a lot of messaging to their local businesses, also trying to provide that information so that they can respond appropriately to the situation as it evolves, and with the resources that the state, federal governments are providing.
I do have another question about enforcement of the stay-at-home order with state police and Hagerstown Police. How can they judge who's essential when a lot of people traveling in the tri-state area have out-of-state license plates? What will enforcement look like once it starts in full? Are you going to be pulling over random drivers? Will there be checkpoints in the city of Hagerstown and around Washington County? How exactly do you plan to enforce the stay-at-home order?
Well, I would point out that the governor has issued a stay-at-home order and not a shelter-in-place order. So we are not in a situation where martial law has been declared. I have heard nothing that there would be any indications that there are going to be checkpoints set up or anything like that. So while I understand how that question arises, I would reassure people, again, to use common sense, use their best judgment to comply with the governor's order. There's been some guidance from the State Department of Commerce that if a small business has workers who are essential, they may want to provide those workers with a letter simply stating what their position is and that they are considered essential.
One more. Will there be any furloughs or layoffs at the local state level and maybe Hagerstown can speak to this about furloughs or layoffs potentially for people that aren't deemed essential, I guess.
Let me speak briefly from the county perspective, and then I'll let Scott address it from the city of Hagerstown perspective. But the commissioners have been very concerned about the economic impact this is having on people, on businesses, on county employees, and they have made every effort to make sure that those employees will continue to get their paycheck. There are no reductions in force or layoffs planned at this time, even though we are working differently. County staff is still employed. We are evaluating the filling of open positions going forward and limiting the filling of those positions to only critical personnel or personnel that may be needed in this emergency environment. Scott?
I would just concur with that. We have no plans at all to do any type of staff modifications, reductions, furloughs, anything of that nature. There will certainly be evaluations moving forward as to processes and those type of things, but it is our intent to keep our staff employed, keep our staff working productively, and continue as normal.
Thank you. Any other questions? If not, we will say good afternoon. Please be safe and heed the recommendations of the health authorities. Thank you.